Does fibromyalgia qualify for disability? Hello everyone and welcome. Today we're diving into a topic that affects many people, fibromyalgia and your possibility to qualify for disability. Fibromyalgia impacts many people for their ability to work, but does it qualify for disability benefits? Let's break it down. First, it's important to understand that fibromyalgia is a chronic condition characterized by a range of symptoms, including widespread pain, severe fatigue, cognitive difficulties also known as fibrofog, sleep disturbances. These symptoms can significantly impact daily life, making it hard to perform everyday tasks and hold down a job. But here's the tricky part. There's no single lab test or imaging study that can definitively diagnose fibromyalgia. This means that diagnosis relies on a person's history, self-reported symptoms, and a physical exam where tender points are assessed. The lack of objective evidence can make it difficult to get disability benefits. So, what are the challenges when trying to get disability for fibromyalgia? Subjective symptoms. Because pain and fatigue are subjective, it can be difficult for others to understand and validate the level of disability. Fluctuating symptoms. The condition can wax and wane, making it hard to maintain a consistent level of function needed for work. Lack of objective markers. The absence of physical markers and standard tests can make it hard to prove that you are truly disabled. Despite these challenges, it's not impossible to get disability benefits. Here are some factors that can support a claim. Severity of symptoms. When symptoms like pain and fatigue are severe and greatly limit daily activities and work capacity. Impact on work performance. The inability to perform physical work like repetitive lifting, bending, or standing, or the inability to focus and concentrate due to fibrofog is crucial. Functional limitations. When daily activities and social interactions are greatly impacted and make it hard to hold a job. Coexisting conditions. Fibromyalgia often occurs with conditions like depression, chronic fatigue syndrome, or autoimmune diseases, which can increase the disability burden. Additionally, the Americans with Disabilities Act, ADA, offers some protections by ensuring accommodations are made. That means employers are required to provide flexible work schedules, rest periods, task reassignment, modifications to the work environment. So, what are the actual statistics? While most people with fibromyalgia are able to work, some may still need to apply for disability benefits. Studies show that around 60% of people with fibromyalgia work full-time, while others may work part-time or are unable to work. A study showed that 25% had received disability payments, with 15% receiving Social Security disability benefits. It is important to remember that a minority of fibromyalgia patients, around 5 to 10%, are totally and permanently disabled. Many people with fibromyalgia must make career changes or job modifications in order to remain employed. It's important to remember that every case is different. Whether or not someone with fibromyalgia qualifies for disability is assessed on a case-by-case basis. This means an assessment is made considering the severity of symptoms, functional limitations, and the impact on a person's ability to do their job. If you are considering applying for disability benefits due to fibromyalgia, it is essential to document your symptoms thoroughly with the help of your healthcare providers. Seek support from patient advocacy groups and mental health professionals. Educate your family, friends, and employers so they can best support your self-treatment plan. Be patient and persistent as the process may be lengthy. If you have further questions, please consult with a healthcare professional and disability advocate.